Introducing the Red Measles by Tori Wilson, so myself. Signs and symptoms include a hacking cough, a runny nose, a high fever, red eyes, complex spots, so small red spots, with blue-white centers that appear inside the mouth. There's a rash that breaks out 3 to 5 days after symptoms begin. The rash can coincide with a high fever. It's a red-brown rash, and it first shows up on the forehead as flat red spots. It spreads from the forehead to the face, down the neck, torso, arms, legs, and feet, eventually covering the whole body. It typically goes away after a couple of days. If it doesn't, see a doctor. So transmission routes, or the way it spreads by breathing, through direct contact, so even just touching someone. Symptoms might not show until 8 to 10 days later. The contagion lasts from 4 days before the rash appears until 4 days after. And you're most contagious when they have a fever, runny nose, and a cough. The Ottawa Public Health regulations and requirements include exclusion 4 days after the onset of the rash, and you must report individual cases to this number, 613-580-6744, extension 242244. So preventing infection in an early learning center or in a childcare facility. So you must ensure that children have been vaccinated or are at least up to date with their vaccinations. Documenting children and childcare professional immunization records. Encourage families to speak to their family doctor about their child vaccination status. Childcare professionals must be able to identify signs and symptoms of the measles, and immediately notify public health officials of any suspected measles cases. The infected child in a center. So this is if the child is in a child care facility. So exclude the child for 4 days after the onset of the rash. If possible, have them stay home. Wash hands frequently. Cover mouth and nose when sneezing or coughing. Avoid sharing utensils, water bottles, or other items contaminated by saliva or respiratory secretions. So basically anything that you've breathed on. Alright, so if a child has the measles, you take them to the doctor. Unfortunately, there's no prescription medicine to treat measles specifically, but acetaminophen to relieve fever and muscle aches. Rest to help boost the immune system. Have them drink plenty of fluids, so 6 to 8 glasses of water a day. A humidifier to ease a cough and a sore throat, so just by making the room less dry. And vitamin A supplements. And these are my references. Give a nice good zoom there. And that's the end.